Welcome to the Movement Upgraded podcast. I'm your host, Dr. Jen Hosler, licensed physical therapist and certified strength and mobility coach. Here you can expect to hear about all things movement. The Movement Upgraded podcast is a blend of the science of strength training, rehab, and mobility, mixed with the personal and professional experience to provide you with the steps you need to keep your body pain-free and moving well, so you can do what you love forever. Welcome to episode number 12. I actually have a guest here for this episode, which is very exciting. It's our first guest. So I have Dr. Ryan here. He's my husband, the other half of Movement Upgraded. He is a chiropractor, we are an interesting duo. So I'm a physical therapist, he's a chiropractor, and I think that has been interesting to people ever since we shared what schools we were going to and what we were choosing to study back in undergrad, even high school. I feel like that was when everything started. So basically since we started dating. And so everybody is super interested in how a physical therapist and a chiropractor can get along, much less be married and then own a business together. And so I think there are a lot of misconceptions about chiropractors and chiropractic work and their relationships with physical therapists and how we all get along and what we do. And I've definitely experienced a lot of interesting things when I tell people that Ryan's my husband and what he does. And so we're going to talk about that in the podcast. I am putting this together because I think that people are interested in learning. I asked on Instagram and they were, and I also just think that there needs to be a little bit more education about chiropractic work. And so Ryan's going to come on and talk a little bit about his experience, what he does, and kind of talk about his profession. So quick background for Ryan. He obviously, I kind of already told you what he is in the business and who he is to me, but his background is in exercise science first and foremost, just like mine. So we actually went to the same undergrad. I'll even backtrack just a little bit more than that, actually. We met our senior year of high school. We were high school sweethearts, and we both had been planning. I think we met towards the end of senior year, so we both had been planning on going to the same undergrad college, and I ended up starting to study psychology. He always went the exercise science route. I realized a semester in that psychology wasn't what I thought it was going to be, and I had always wanted to go into physical therapy school, and I was learning about what he was studying. I didn't know I never heard of that as an option. And the more I researched it, the more it made sense going into physical therapy to have a background in exercise science. So I switched majors. We ended up in a lot of the same classes, obviously, because we were in the same track, which was really fun because a lot of our colleagues had no idea we were actually dating. But we both have a degree in exercise science. I think it's technically says we majored in kinesiology, but that's our bachelor's. And then I went to physical therapy school and Ryan went to chiropractic school, and we both moved down together. I think we got married right after we graduated from undergrad. We both moved down to the Tampa area to go to our grad schools, and we've been here ever since, and we started Movement Upgraded. So with that being said, Ryan has a similar background as me. But when we went to grad school, obviously we went our separate ways, and he became a chiro and I became a PT. So I am going to start out by first asking Ryan why he chose to be a chiropractor. So first, welcome on, Ryan. Say hi.
Yeah, thank you. This should be exciting. Thanks for having me on. So I'd say, why did I become a chiropractor? It's just because of my experience in the physical rehab world. So dating all the way back to high school, when I played baseball, I just developed shoulder pain. And it wasn't from like a onset of an injury or anything that happened abruptly, but it was more of a gradual onset of shoulder pain, just repetitive overuse because I didn't have good shoulder mobility, good control of my body, and I didn't have a solid strength program, I would say. Didn't have solid strength. I just did the traditional high school bro workout, just going into the gym to look good for the girls or whatever. But
hey, it worked.
But I mean, I developed shoulder pain as a result of just playing baseball, and so I didn't have access to a lot of the stuff that you guys all have access to now, like social media, because I didn't have a smartphone to like be able to go on YouTube or Instagram or Facebook or TikTok or whatever to like find some self-help stuff. And all that my parents really knew back then was, let's just go to the primary care doc and see what they say for your shoulder. And then the primary care doc was like, well, you have shoulder pain. This isn't really my expertise. Sends me over to an orthopedic surgeon. Orthopedic surgeon says, well, let's get an MRI to see what's going on with your shoulder. If there's anything going on, we can then do surgery. So I get an MRI for my shoulder. This is going to be a nice long story, but it leads all into why I became a chiropractor. Find out that I could potentially have had like a slap tear, which is just your superior labrum tearing from your anterior part of the labrum to the posterior part. And he wasn't even able to really like confirm that. And he was like, well, we could do surgery. You have a 50% chance that the surgery is going to be helpful, or we can go like this rehab route and I can give you some exercises. Well, I'm like, well, I don't want to miss my senior year of baseball. So like, let's try some of the physical rehab exercises. So he gives me like a generic handout of exercises, and Jen's already shaking her head because she worked in like the traditional insurance-based PT world. She knows what those exercises are.
Yeah, and also if they're coming from an orthopedic surgeon, like surgeons are really good at surgery. They don't know anything. I wouldn't say anything, so I'll step back before I get a bunch of surgeons hating on me. But they really don't have expertise in rehab and exercise. So they can give guidelines. We should work together in rehab, but they should definitely be referring out to the experts, which are going to be physical therapists for that. So that's why I'm shaking my head, but we're going to continue on with Ryan's story.
Yeah, so you just gave me like the generic handout of do these TheraBand external and internal rotational exercises, do like 3 sets of 20. I don't even remember off the top of my head, but something very generic. And I just thought it was kind of silly because I was already like in the gym lifting lots of weights and like doing things that I felt like were more beneficial than these little exercises that he gave me. Like,
I'm sure that's how a lot of our patients feel when they work with some of the stuff that we do. But
yeah, sure. But like there was no education given or anything. Like just do these.
Or like, what do you feel when you're doing this? Let's make sure this is doing what it needs to do. Yeah. But again, he's not an expert. The orthopedic surgeon's not. So that's something your rehab clinician should be going through with you.
Sure. Like, yeah, my muscles are burning doing these because I'm like training for endurance versus like strength, but like I didn't really see why I should be doing these and like how this was really going to help, because I'm doing other exercises and stuff that like I felt strong, you know, like I could chest press and like pull heavy weight and stuff like that. Why am I doing little banded exercises? So I didn't really get the connection there. But anyways, like I went this route with like the exercises, gave it a shot, didn't really get much relief, and I just said, well, I'll just kind of like play through the pain and whatever, like we'll keep doing it. But it wasn't until later on that year when I was still playing baseball that I developed low back stuff that just kind of crept up. And then I actually went to a chiropractor just off a recommendation from, I think my dad's like coworkers said that he was a good guy, like go check him out and he'll help you out with your low back. But in his intake process and like his exam process, he asked me if I had anything else going on, and I told him that I had some shoulder stuff going on. So I go in for back pain. He ends up probably helping me more so with my shoulder problems than my actual back issues, which we'll get into later. But
well, that's ironic.
Just the whole like the whole approach and the way that he did things, just it like vibed really well with me. Like I didn't like going to the orthopedic doc and him just like giving me generic exercises and like saying, well, if this doesn't work, then like surgery is the other option. Like this chiropractor took the time to like talk to me, give me different exercises that made more sense for me and what was going on. He gave me more education and gave me more hope and self-help things.
Coached you a little bit.
Yeah, exactly.
There's a little coaching. That's a big part of our job that I think most clinicians are lacking, or most people don't recognize that's what we do. But it's not just the list of exercises, it's the coaching, it's the education, it's a lot of that stuff. And that's just what the difference was for Ryan. Yeah,
so I mean, just my experience there, even though he didn't necessarily fully help me with my lower back issues, like my shoulder felt better. I was able to play through my senior year of high school, like baseball, felt better. And I just kind of felt like there could be something to this. Like, I kind of liked his work environment. I kind of liked his day-to-day things. Ended up shadowing a couple other chiropractors, and they just seemed happy in what they were doing, and it seemed like something that I could do. So I pursued it a little bit more, doing some education. And like Jen already said, like, I knew I wanted to do something like active. I was always active playing sports. I loved exercising. Then went that like exercise science route in undergrad, really enjoyed it. And I was like, well, I don't know if I always just want to be a trainer for all of my life. So like, what's the next thing that I could do? And I just, because of my experience, thought that going to be a chiropractor was the thing. I never really had that experience with a physical therapist.
Yeah.
So looking back at it, maybe the way that I end up practicing now is more in line with like what most people would think a physical therapist would do. But I just had that background, and I'm a chiropractor.
Did you consider or look into physical therapy when you were doing this, or was your like you were just kind of tunnel vision chiro because that was the experience you had?
Again, like, I didn't really know much as like a high schooler. Like, I just kind of went
What?
the route.
You're supposed to know everything. At 18, you need to figure out your whole life.
Yeah, I just went the route with like what my parents thought was best for me, and I mean, it definitely helped me out, and it led me to where I am today, so I don't regret any of it, and I don't think that they would either. But no, I don't really think I ever actually saw a physical therapist for any of my issues. It was just, you go to the doctor says go to an orthopedic person says surgery or whatever.
And then you ask around.
Yeah.
Where else is everybody going? What are you doing?
Looking back at it, it's interesting, though, that like the orthopedic doc didn't even refer out to a physical therapist.
It's
because
so
like
uncommon.
They should have done that, right? Like, it's sad that that's not commonplace, or at least back then it wasn't. I still think that it's not very common for orthopedic docs to do that.
No, it's in like the guidelines. Like that should be like in the research. It's like what you should be doing in the protocol is like surgeons should know, okay, surgery is appropriate or not. They should give education, and then they should be like, well, it's not appropriate now, but let me send you to the expert who's going to be appropriate for you at this point. Most of the time, surgery should be a last case like result, unless we have something that's like, I don't know, an emergency situation or something along those lines. But majority of musculoskeletal injuries and issues are definitely going to be rehab first. And I think rehab back in the day used to be only post-surgical. Like, we still kind of have that old school thought of, oh, you're a physical therapist, so you work with people and rehab them after surgery. I'm like, yeah, no, like personally, that's not what I do very often anymore, because I think it's like super boring, and you can go to any regular therapist and they'll be able to rehab you after that, because it's pretty easy, I would say. It's not that it's not hard. It's just not the same as what I prefer to practice. But it turns out we actually should be like the first in line for like almost all any type of back pain or joint pain or anything like that. So,
which kind of leads me into another thing, but before I get into that, I wanted to say, like, if you go to an orthopedic doc and they give you exercises and those exercises don't work, don't give up, because you you have so many more options than what their recommendations are. Like, you can actually walk into a PT's office and get an actual evaluation from a physical therapist, and it's going to be way more tailored to your mobility limitations, your strength deficits, and stuff like that.
Of like an analogy right now, that if you go to like, I don't know, a plumber for an electrical problem, like, and your plumber gives you a list of things that you can do for your electrical issues, like, and it doesn't work, you don't just say like, oh yeah, electricians aren't for me. Like, you never went to an electrician, you went to a plumber. Like, that makes no sense. And of course I'm going to use plumber because my dad is a plumber, I guess. But sometimes that makes a little bit more sense. So what Ryan says is very true. Don't give up. Even if you go to one clinician, don't give up, because there are different approaches to practice. And we're going to get into that towards the end when we talk about the different ways or not that Ryan and I practice with our different professions. But everybody has different approaches and different backgrounds and different expertises and different ways that we like to practice. And you're just, not all of us can have every single tool. There are so many different approaches out there. It's not even fair to expect every clinician to know all of the things. There are standards of practice that I think are not met a lot of the time, and that's frustrating, and I'll validate that for a lot of people. I'm not going to get into that because this is Ryan's podcast about his background, but did you have something else you wanted to add?
Yeah, I'm going to throw in one thing, and I think this is the other thing that led me to becoming a chiro versus a PT, and it's not necessarily the same, or it's not necessarily that way any longer. It was just a law that led me the Chiro route. And it's exactly what we were kind of talking about, that you can just walk into a physical therapist office and get evaluated. We call that direct access. So like when we were in undergrad in Indiana, you did not have direct access as a physical therapist. So you actually had to get a script from a doctor to go see a physical therapist. I don't think that's the case in like most states anymore.
Any of them. I think we have direct access in every state finally.
Right.
Because we have a doctorate. That's like one of the reasons they wanted us to go get a doctoral degree. Sure. So.
But as a chiropractor back then, like you didn't have to get a script to see a chiropractor. Like anybody could walk off the streets to see a chiropractor. And that really...
So there's less barriers.
Yeah. And I really like that. And that was kind of one of the other reasons that it led me that way.
What I wanted to ask you is, did you consider going the physical therapy route for your career ever?
Yes. So I did. And I think the biggest thing is I was always a good student, but Jen was definitely a better student than myself. Like I struggled with physiology in undergrad, and I was like, I'm never going to use this. And I think I got a C in that class. But I did end up going the pre-med route because I was like, do I want to do PT or do I want to do Chiro? So I was like in between what I really wanted to do. And I struggled with like the organic chemistries and some of the other chemistries. So I just never really even applied to PT school because I didn't have straight A's like Jen did.
Yeah,
and
so
like if Jen got a B, she kind of freaked out because she didn't think she was going to get into PT school. Like that's how intense it is to get into PT
That's
school.
what I was going to say. So it's not just physical therapy school is highly, highly competitive. My classes, in my first class, I think there was 1,200 applicants and they took, I want to say like 36 people, maybe it was 40.
It was something
and
crazy.
And I'm pretty sure 7 of those actually came from like a certain school only. So really I was competing against like 29 or 20, whatever the math is. Again, math's not my forte. But whatever those amount of people. So out of 1,200 people, you have to be one of like 20 something. So that's highly competitive. So you have to have very good grades. You have to have very good, GRE score. You have to have you have to be very competitive. And I am super competitive and kind of, Ollie might disagree. There he is barking about that. But that is the gist of getting into PT school. That's kind of well known. That's like, it's just hard. It's like very competitive, just like med school is. But chiropractic school is not quite that way. Ryan can kind of talk on this a little bit, but it's a little less stringent. There's not as many applicants, and I think they have rolling admission, which means they have more than a typical PT school, which is going to have admissions starting once a year. So they're not going to take multiple rounds of students like a chiropractic school would.
Yeah, I could say things, but I think that I'll refrain from saying things because I feel like you still had to have good grades to get into Chiro school. But
it's not easy. We're not saying it's easy at all.
But I do feel that a lot of people were accepted and they started school and then they realized it wasn't for them and then they would drop out. And I feel like almost some of the schools were kind of money hungry in a way because
all of them are. That's
you know
their
that
goal.
They've got a whole semester of tuition out of that student that would drop out and they didn't get refunded that money.
Versus physical therapy schools are so worried about their dropout rate and their pass rate for the NPTE at the end that they only want like the top students because they don't want people dropping out because that looks bad and I think it affects their funding. So this is going back into like quite a bit of detail, but that's why Ryan ended up going more the Chiro route. So obviously his experience is going to dictate most things. And then there were just more barriers to getting into PT school. So he was like, I already kind of want to be a Chiro. So may as well just go down with what I know. And I think that's what ended up like having him go down that path. And I knew this when I met him, but I personally, you guys have known my story, but I had injuries in high school and I had physical therapy the whole time. And I had a good experience with my physical therapist, despite the fact that now that I'm older and gone through a lot of education, I had subpar rehab, but I liked the physical therapist. I had a good relationship with him. He was like super fun. I liked his personality and he just like, I just really liked what they did. And I think it was pretty cool. And so, and I thought it was really valuable too. So I went down that route, never knew about chiropractors. And actually, what the general consensus in my family about chiropractors is they're
Wasn't
quacks.
that good.
It's that they're quacks.
They were like, why are you doing this? Why are you going to go that route?
So my family was kind of like, okay, he goes to a chiropractor, like side-eyeing, kind of like, it's interesting, they're quacks, like, so Ryan was all about it. I was like, okay, I mean, I've never been to a chiro, so he ended up trying to help me with my back issues when we were dating and first dating, and I was really struggling, and I ended up going to a couple chiropractors, and I do think they helped me, but I was never given physical therapy or rehab for that, and that's a different story. But that was my first experience, was because of Ryan, and it was very interesting. But I think that when we were in undergrad going down those different routes, Ryan was always saying too that he's going to have to own his own business. And he was like, that's what a chiropractor does. Most people open up their own clinics. You don't make very much money if you work for somebody else, like not at all. And so that was his, like, that was always going to be, the movement upgraded was always going to exist according to Ryan. I wanted nothing to do with owning my own business, by the way. Fun fact.
That was like one of the biggest things, though. Like going back to my experience with that chiropractor, he was a happy guy in his like work to life balance, or so it seemed. Like
when you know,
come to find out, there is definitely a lot to owning your own business that I had no clue. But his day to day seemed like he had control of his own schedule. He could do things he wanted because he was his own boss, and that really appealed to me.
Yeah, and that was the opposite. I wanted nothing to do with it. I grew up in a family who had a family-owned business, a small... if you can hear Ollie in the background, I have no idea if you can, but he decides now is the time to eat his loud crunching food. So sorry about that if you can hear it.
And now to drink his water.
It's just a whole family podcast today. But I lost track now of what I was saying.
Owning our own business.
Oh, and I wanted nothing to do with it because I had a family who did own their own business, and my dad's office was in the backyard. And so he had a 24-hour plumbing business. He still does, but it's a little different now. But he was always working on the business, and I watched him pour his life out into this business. They took calls at 3 a.m. My dad was out late, getting up early in the morning. He never slept. His like motto when we were younger was sleep when you're dead. And I appreciate a lot of who he is and what he did because I got my hustle grind from him. But oh my gosh, I was like, I never want to own my own business. This is so stressful. Like my dad's stressed all the time. It's following the business or following the family everywhere, interrupting our family dinners. Like I didn't want that. So when Ryan was saying that, I was like, you go ahead and have fun with your business because I'm going to go work for somebody else as a physical therapist. And now it's just funny how we've come full circle. And I'm actually really appreciative that Ryan wanted to do that because now...
There's no way she could work for anybody else.
And I changed my mind, I want to say, right at the very beginning of physical therapy school, probably, or maybe towards the end of undergrad. When I started to shadow and really see what the world was like for physical therapists.
And it was definitely confirmed your first year out when you had to take a job just to help ends meet for us, because that first year of you working in that insurance-based job, you were miserable. That was like, definitely, I'm getting out of this, and we're owning our own business.
It's not sustainable. It's just not. It's not a very... And I worked at a clinic of nice people. Like, they were so surprised when I quit because they were like, I didn't know you're so miserable. My patients even said that. Like, I didn't know you're so miserable. I was like, I was crying on my way to work almost every day because I was so stressed. I was crying on my way home. I was crying at home on weekends. Like, it was very stressful. And I hate that. It was so stressful, but it was. And my director, I had posted something about this on Instagram once I finally quit and was like, I'm so excited for the next year. This was the hardest year of my life. And he was like, you should watch what you say on Instagram. People are reading. And I was like, I'm sorry, but I should watch if I say the truth. It was very interesting. But he was like, were you really that miserable here? And I just think it's really unfortunate that it's such a toxic culture that you can't be honest, and people's humanity, our physical therapists' humanity can't be put first. And the people who end up losing out are the physical therapists because they're no longer like, they're going to get burnt out. So they're not going to have empathy. They're not going to be able to provide patients with decent care. They're not even going to be interested in continuing to learn because they're just stretched so thin with paperwork, seeing 2 to 3 patients plus, I've seen 4 at a time per hour, plus all the paperwork and getting paid crap, to be honest. And a lot of that there's multifactorial, right? I'm not going to go through all of that, but that's really hard. And the people who lose out are going to be the physical therapists, of course, but the patients, like, people aren't going to get good care. And I know that happens because my entire practice is built off of people not getting good care from the traditional model. And it's really, really unfortunate. So with all that being said, I'm really glad that Ryan went down the route that he did and that we ended up like this. So it's definitely not what I had originally thought, but it worked out. And it's kind of ironic how other things came full circle too. So with that being said, I kind of want to talk about what school is like for Ryan so you guys can get an understanding of like chiro school versus PT school. And then we'll talk a little bit more about the chiropractic profession and some things that are very common in the profession. So let's talk about what school was kind of like for you.
Sorry about the dog. First, I guess I should say is that like there are different types of chiropractic schools, and while everybody graduates as a chiropractor, there are definitely like more philosophy-based chiropractors, and then there are more evidence-based chiropractors, and there are different schools that tailor to those different thought processes. So when I was applying to chiro school, I applied to National University of Health Sciences, and that is a very evidence-based school where they teach their students to become more of, like, I would say, a medical doctor or a medical student, and they emphasize the chiropractic adjustment so you can actually adjust your patients and physically rehab your patients. So I did go to a very heavily science-based school. Like, if you graduate undergrad, I think you graduate with like 120 credit hours. When I graduated chiro school, I graduated with 248 credits. So like it was very heavy in science and it was very intense. Like we were going year round for 3.5 years. It was a lot. Like I was fried at the end of it. I was glad that it was done.
He's still recovering.
Yeah, seriously. Jenna's too in a way.
Yeah.
But I think that people don't realize how heavy chiro school is, like in the sciences. And I'm glad that I did go to a very evidence-based school because I can't speak for the other schools, but I didn't get much like philosophy or theory, I guess, of like what could be going on when you do an adjustment. Like I was taught that like the adjustment is to help people get out of pain. It's to get a little bit more motion into the joint, which I think leads into maybe some other questions that Jen might have. But there are theories within the chiro profession that like you're taking pressure off of the nerve and you're restoring nerve interference, or you're restoring nerve function to the body and the body functions better and all that stuff. Like I didn't learn any of that. Like I was taught how to feel joints, and what those joints felt like would then indicate like whether or not you should manipulate or put motion into a joint.
You would feel the joint moving.
Yeah, you would
not
feel
just
the
feeling the
play.
joint. It's not the joint out of place,
Right.
which we'll kind of talk about in a minute. But
Yeah.
So I want to stop for just a minute and backtrack. So when you say science-based, like what kinds of things are you talking about? So what do you mean when you say science? What were a lot of your courses like?
Like I got basically probably all of the same anatomy, like dissection of cadavers that Jen got in PT school, all of the same physiologies, literally any science, all of the chemistries, all of the same things that a medical student would get, all of the sciences that a PT student would get. I got the same sciences. Like you don't just make up sciences, it's science. Like
Yes.
every textbook was probably the exact same.
Yeah, like pathophysiology,
Yep.
anatomy, all of those types of things. So
Pharmacology, all of those things. We got the same courses.
yeah, so he still has chiropractors still have a lot of knowledge, and a lot of knowledge about the body, the human body is what I would say. When he says things like theories about an adjustment, so what is an adjustment?
An adjustment is literally just using your hands to put motion into a joint using like a high velocity, low amplitude thrust. So it's just a quick thrust that puts movement into a joint.
So you'll see these videos on TikTok because this is like there's a paper that just came out about how problematic some of this is for chiropractors, which led me to wanting to record this actually. So the videos you'll see on TikTok will be chiropractors adjusting their patients or their clients, and I think that's like a big thing like that are associated. You see a chiro, you just assume adjustments because their entire profession was based off of or founded off of what, Ryan? The theory.
Theory. I don't even really know the full story. I think it was like some guy this is how much I got in school about theory. But I think it was somebody adjusting a patient to restore deafness or eyesight or something like that. But it was theoretical.
But the theory that their profession is kind of based off of is the nerve interference, is what I was getting at. Yeah, which he already touched on a little bit. I was just kind of
There's literally no science to support that theory, by the way.
Right. So their profession's based off of that, but Ryan received an education that showed that, like, we're going to get a lot of the science and, you know, prepare you to read evidence and know how to practice. And they did get some rehab in their classes too. So they did learn some of that stuff. And it depends on what school, how much they focused on that whole nerve interference thing. I don't even know if some of the schools do focus on that a lot.
I think some schools do.
But there's not research like to support what they're saying. Not enough to support. There's a lot of maybe like low grade evidence of what they're saying, but a lot of what you will see on things like TikTok is the chiropractor doing that adjustment because that's what they're known for, right? And the adjustment is not problematic. It's not that it's complete bullshit. It's definitely can be beneficial when it's needed. And there are some things that happen because of it. And sometimes you'll get what's called a cavitation. Sometimes you won't. The cavitation is the noise that you hear, the really loud crack or pop. But it's not necessary for it to be successful or considered successful. But that's what chiropractors are known for. Physical therapists, we don't do adjustments, but we can do literally like the same
exact thing.
It's the same technique. It is just we have to, depending on what state we're in, we have to call it something different because the chiropractic board in different states and the physical therapy board in different states get so mad at each other that they want to remove any other profession's ability to do the same thing as them because we forget that we're all fighting the same fight against sedentariness and opioid addictions, and instead we're so focused on fighting each other for the same people who are all, like, when there's so many people that just need our help. So that's all that I will say about that. But when you see a chiropractor, you'll typically hear the adjustment type of or see the adjustments, and the effects of it are overstated by their profession. I think that's what I would say.
100% agree. It's it can be a piece of the puzzle. Like, you can utilize it. It's another tool in the toolbox, but it shouldn't be the only thing utilized. Like, you should still, in the end, provide some sort of exercise to your patients, provide some sort of empowerment and self-help and education.
Yeah. So what things are an adjustment good for? Like, what are the benefits of it?
I would say the biggest thing is if somebody's in so much pain that they're not able to exercise or move, and giving an adjustment helps kind of give you like a window of opportunity to then move around a little bit more freely and a little bit more pain-free, then you should utilize an adjustment. But I personally don't even adjust anybody just because the people that we work with, they've kind of already gone down that route of like getting adjustments. They've gone down that route of like traditional PT. So why would I do things that you've already tried that aren't necessarily giving you the results that you want? My time can be then better spent giving you better exercises.
The time that you're paying for.
Exactly. To like really actually help you with things that I know that you need and that you'd benefit from.
Yeah. And a lot of the benefits of an adjustment, or in physical therapy, we call it a mobilization, because that's what it is. There can be different grades of it. If it's a grade, 5, is when we do the thrust, but a grade 4 is just not adding the thrust. There's grades of mobilization. It's just moving your joint, right? Those benefits are immediate, like decreased pain, typically, sometimes, and there can be like a relaxation response of the area around, and the effects aren't just at that joint. So one of the theories and myths that we were taught, that Ryan was taught a little bit, maybe, I don't know if he was, is that you're very specific with the joint. So if you move a joint, you feel a joint, you palpate, you are feeling which joint is moving. So if we talk about the spine, for example, there's 24 segments. You're finding the one segment that's not moving, and you're only adjusting that one segment. Well, the research shows that we're not very good at figuring out what segment we're on. We're usually like within, I think, 3 segment range. Also, when we do any mobilizations, it's felt multiple levels above and below. So the effects are not just in that area, they're multiple across. So we aren't as specific as we think we are when we're doing them. And that just kind of reinforces the idea that an adjustment isn't the end all be all. It's just a piece of the puzzle, and it can just open up a little bit of pain-free range of motion, ability to do things. But in the research and the thing that we know as clinicians is that it always needs to be followed up with movement, because the reason that that joint is not moving very well or needed to be mobilized is because it's not getting movement throughout your day. And we need to make sure that we tackle the actual root causes of or contributing factors of the problem, which can include things like stress management and sleep, by the way. All of those things matter. So as a clinician, it's our job to figure out all of those things. And an adjustment makes you be reliant upon another person. So if you come to a chiro, any sort of clinician, and you're in pain, and the clinician's like, my hands and my adjustment are going to heal you, then you have to keep coming to them. You're not empowered to do anything. You feel broken and they're fixing you. And that power dynamic is really problematic for a lot of different reasons. Instead, the research shows that we need to empower you to know how to deal with your issues. What happens if it flares up again and you don't have access to a chiro? That's not really helpful. That's really disempowering. That makes you feel like you have nothing in your own power to deal with your own body. Hello, I've gone through that. It's not very fun. And to think that somebody else can heal you and you can't heal yourself is just kind of asinine, in my opinion. And so you shouldn't be going to anybody who makes you feel that way. And if you do, it's one of those yellow, it's probably a red flag, to be honest. And that's something to consider. So with the adjustment, I wanted to talk about one other word that we'll hear sometimes in the chiropractic world, and that is the idea of a subluxation. So I'm going to tell a quick story, and then I'll let Ryan explain what this is.
I'm just rolling my eyes. You can't see this, but my eyes are rolling.
So in one of our family Christmas parties, I want to say, when we were first in PT school, it was our first year home. Oh, how many years ago was that? 7 years ago, something like that. We went to our family Christmas party, and I have an older cousin who had just graduated physical therapy school, and he knew that Ryan and I were in chiro and PT school. And I told you in the very beginning that people think our professions collide a lot and that we wouldn't get along. And so he literally, I think he had been drinking a little bit, ran up to us. I hadn't really talked to him, looked at the two of us really close in our face, and just went, subluxation, and just ran away. And I think he was thinking that we would get in this big argument about what a subluxation is, but of course it didn't happen, because you guys know that Ryan and I are not very different. We're actually very similar in a lot of ways in our practices, and we read research, and Ryan's not one of those chiros, quote unquote. So tell me about what a subluxation is, Ryan, or what it's supposed to be.
Yeah, a subluxation literally means a partial dislocation of a joint. That's what it means in the medical world. But of course, chiropractors, they have their own definition of what a subluxation is, which is just silly. And it goes back to the whole philosophy thing. But in the chiropractic world, I would say, I don't even fully know, to be honest. This is bad. But I would say it's more of a bone pushing on the nerve a little bit that's causing nerve interference with the entire nervous system. And then the adjustment would remove that subluxation, not push on the nerve, and then nerve impulses would be normalized throughout the body and you would function better.
Yeah, and you'll hear the subluxation as something is out of place. That's also a common thing.
Yeah, that's a little bit more extreme. I think that's just more so chiropractors definitely just not knowing how to speak to their patients in a way that they can understand.
I mean, it really, if we oversimplify everything and just say, yeah, your spine is just, your bone's out of place, your spine's out of place, it's pushing on a nerve that's causing pain, let me just put it back in. Yeah. So simple, right? Out of place.
You have all of these football players getting tackled like crazy and their bones aren't falling out of place. That's just such a reductionist view, and it makes us seem so fragile.
Yeah, it makes you feel fragile. Also, we both dissected cadavers in PT school and chiro school. The cadaver that I was assigned was an older woman who went through breast cancer, who was very tiny and I assume very fragile when she was at her end of her life. And one of the, if you're squeamish, you might want to skip past this a little bit, but towards the end, when we had to work on the spine, we actually had to chisel away and open the spine up to dissect it and see all of the different areas and parts. It took us, I believe our lab was 2 hours. It took majority of the time to chisel and open her spine. And this is a fragile woman who likely had osteoporosis because she died with breast cancer that had metastasized. So her bones are probably fragile. It took us forever to fracture her spine or to move her spine. Like, it was not easy. And so to think that our spines...
Not to mention all of the muscle layers you have to cut through to even get to the spine that are holding those joints.
Yes.
Like in place.
And ligaments and fascia, like
Right.
all of the soft tissues that is suspending our body.
But
in
no,
the
your
air.
bone can just slip and it's out of place and your disc slips. That's, I'm just kidding. That's a different conversation.
Your disc does not slip. So these are our this is fun dinner party jokes for Ryan and I. This is what our dinner conversations are sometimes. It's really fun to take us out for drinks. But in reality, the reason I wanted to bring this up is because the idea of a subluxation is an actual medical term, and you can have a subluxation. Like, we're not saying that's not true. It's definitely possible, but you will know. Like, if your shoulder is subluxed, ouch.
You're going to be going to the ER to have somebody reduce that and pull that back into place.
You're going to see it. Yes, it's not going to be the cause of your pain. Now, can a segment in your spine not move and we need to induce a little movement, or can we help that with an adjustment or mobilization and then follow that up with a lot of like exercise to keep it moving and to decrease the inflammation and reduce the fear or the threat
perception
signal that makes you feel less painful? Absolutely. In fact, that's exactly what we will be doing. And that's what both Ryan and I do. This is why, like, I wanted to put this podcast up, because it doesn't matter if you come to see Ryan or I. If we assess you and we think that's needed, we will do it. Most of the time, we are spending so much of our sessions educating, talking to you, and assessing you, and then trying to give you what you need to at least be working on yourself and have a few tools in your box as you leave, so that in case something flares up or pops up, you have the ability to work on it. We are just not going to be spending a ton of time on manual therapy because of how we choose to practice. I personally don't like spending a lot of time on manual therapy and working on people, only also because it doesn't feel great for my body. It's labor. It's physical labor. It's not easy. So it's not sustainable for me. I wouldn't be able to do our profession very long if I was doing a lot of that. But also the research is like not supportive of it for your entire session. So a little bit goes a long way, and majority of your sessions should be exercise. And no matter if you saw me or Ryan, our sessions would look very, very identical, partially because we have similar biases. Our business is together. We communicate about things when we need, but we also took all of the same courses. So we have a background that's similar. And then in our grad schools, we were both going to continuing ed together. So we took
same continuing ed too.
Yes, like the same classes. And if you go to continuing education is required for your license. So every year we have to have so many hours. But we were doing this in PT school and Chiro school before it was required, because we were so dissatisfied with what we were learning in our respective schools. It was so outdated, so frustrating. I've talked about this in the past. I'm still frustrated about it, but we didn't like it.
We paid how much money for school?
So we paid so much money, and then we're paying extra to go take these courses, and you have a slight discount for some of them as a student, but it's really not very substantial. So instead of partying and doing a lot of vacations and things our friends and classmates were doing, we just went and did more continuing ed. And because of that, we have similar approaches to how we would treat. And the best part of our professions is that you could probably meet and take like 10 different physical therapists, and there would likely be more differences in me and those other therapists than Ryan and myself, even though our profession is different. And the thing that I want to highlight is it's not just because Ryan and I have taken all of these courses, it's also because we both stay up to date on the research too. And
yet, before you go down, hold your thought there, because I want to touch on one last thing, and then if we never talk about the adjustment again, that's fine.
Yeah, I got off on a tangent.
But
my bad.
Coming back to like what the research says and what evidence-based medicine supports, it's an interaction between three things. It's what the research says, it's what your clinical experience is guiding you to do within your treatment, and then it's what the patient expects or what they want to experience in your treatment. So again, I kind of touched on it earlier. I don't really do much manual therapy, and I really don't adjust many of my patients at all. But if they have that expectation as me being a chiropractor to give them an adjustment, and that's part of what they believe will help them, even though I can educate them all I want, they're still expecting that. So that's really kind of the only time that I really put my hands on and actually adjust or give them that like grade 5 manipulation of a joint just when they expect it.
And there's some manual therapy that we both do probably. I can't speak for Ryan. I'm not in all of his sessions. But like we will work on our patients, and if somebody comes in and they're in a lot of pain, especially if there's somebody we've been working on, they have all of their tools, but they're just like, hey, I've got this issue. It's super flared up. Can I come see you? Mm-hmm. We'll do some manual therapy to calm things down. And,
for sure.
And sometimes if they're coming to see us first, manual therapy can be a great time to work on them while we're educating them, and it just depends significantly on the patient.
Absolutely.
But most of the time we would probably do manual therapy on the same person, and we have
Yep.
similar approaches to that. And I think the reason that we are so similar, if you think about the evidence-based triangle that he was just talking about, is because we have similar experiences. So that is like one side of the triangle that are very similar, and then our patients that come in are very similar because they're attracted to our business. We have a certain model of treatment and a certain type of client that we work with, and all of our advertising, marketing, all of our resources, kind of a lot of what we do is going to speak to those types of clients. So they're all going to be very similar. And then the research is there. Like there's not research for physical therapy versus research for chiropractors. There is just research, right? Yep. There's research for low back pain. There's research for different syndromes. There's research for pain. There's research for like all of the different things. And we should, whether or not, whatever profession we're in, we should be consuming the same research because we're treating people with the same issue. So if somebody comes to me with low back pain, I should be reading the low back pain research. So should Ryan. So our approach in that realm should be very similar, if not identical. Mm-hmm. And that doesn't mean it needs to be the exact same list of exercises and the exact same words spoken, but it usually means we need to prioritize, like the big dials need to be similar. So what things are most important for people? Is it education and talking a little bit more? Are we going to focus a lot on exercise? Are we going to focus more on a little bit more manual therapy? We should look at the research guidelines for that. And so that should be similar. Mm-hmm. And the other two pieces of the evidence-based triangle are where we might differ in our approaches. And the experience is going to include some of the courses that we've taken too, because not all of them are just pure research papers. They're guided by research, but those are the pieces of the triangle and why it ends up being important that we treat similarly, and why you'll notice there are some chiropractors who are basically kind of more like physical therapists. And I know there are a couple of physical therapists who practice more like chiros because all they do is manual therapy, but every single clinician is going to have their own approach because that's kind of the way things are. So it's not that we should all be identical. Right. It's just that we should kind of have similar approaches. And some clinicians are going to be better at some things than others. And so it's really important for clinicians to understand what tools they're good at, what they prefer, and to make sure they refer out when necessary. Like I personally don't like working with vestibular patients. So if you have dizziness and you have, oh my gosh, BPPV. If you don't know what that is, don't worry about it. But if you have some sort of like dizziness and you have a potential for that, I will refer out because I just don't like treating that. It's not fun for me, mostly because I didn't want to spend the time to figure out what they were talking about in school. I could not stand to figure it out for some reason. Still don't. It's not my expertise. So I don't have to approach that way, but I will educate anybody who asks for advice from me, and I will send them on their way. So that's just like an example of like your personal scope of practice versus your actual. But when it comes to physical therapy versus chiropractic, this is a question I'm going to ask Ryan. What is the difference in our professions, like scope of practice? Would you say there is a big difference in what we should be doing versus what you should be doing?
I would say no. I'd say our scopes are very identical. It's just knowing what you feel comfortable as a clinician treating. Like right. You should know your own personal scope. Like we can both treat all of the same musculoskeletal problems, but if you feel more comfortable working on, like Jen said, like vertigo or BPPV, like work on that and stick to it, and then send your low back people to somebody who you know can help them.
Yeah, and I think it's important to recognize or explain, if you aren't familiar, a scope of practice is just, there are two different kinds. There is legal, so there's what you're legally allowed to do with people, and then there's personal, what you feel that what boundaries you want to set as your personal scope of practice. Legally, the scope of practice for chiropractors and physical therapists is set by our state guidelines, so it changes by state, and there are small changes that are in each state, and some of those for physical therapists is like what we're allowed to treat, how long we're allowed to treat somebody if they have not seen a physician prior to seeing us because of some of those old rules, whether or not we're allowed to do dry needling, things like that. For Ryan, his scope of practice is going to be changed. I don't know what types of things are like different in different states for you. Are there a lot of differences?
I honestly don't know. I couldn't tell you, so I would have to do some research on that. I'm not afraid to tell you that I don't know everything. I would say the biggest thing isn't necessarily scope of practice, but this kind of goes to the insurance side of things. And Jen and I, we're out in network, like we're private pay. We don't deal with insurance companies directly with our patients. But if you go to a chiropractor, you're more likely to receive an adjustment only because the chiropractor is going to get reimbursed more for giving you an adjustment than they would providing you with rehab or some physical therapy exercise. Whereas if you were to go to a physical therapist, I think they're going to get reimbursed more for doing physical therapy and neuromuscular reeducation and therapeutic exercises than they're going to like get reimbursed doing like a grade 5 manipulation or whatever.
So I think that's what's hard about the whole reason.
Dang, insurance companies ruin everything.
This is like back to me saying it's so hard for physical therapists to stay in the profession when they work in typical clinics. And it's also just so hard for chiropractors to actually practice their standard of care that they should be practicing and following the evidence, because there's so much red tape that we have to follow. And
like, why would a chiropractor want to spend 30 minutes with a patient? Well, I know why they should, because it's the right thing to do, but why would they want to spend 30 minutes doing rehab with somebody and get paid $50 when they could spend 3 minutes to provide an adjustment and get paid $60 or even $50? Like, there's a lot of time.
And it's not just that, and I will say it's not just that, like, so it's hard because chiropractors own their own clinics, right? So they're trying to operate off of making the most for their clinic versus a lot of physical therapists are working for other clinics that are owned by other people, but there are standards they have to meet. So there are going to be meetings where they're going to be told they need to be billing correctly. And we could talk a lot about whether or not that's ethical, but it doesn't matter. Your physical therapist has somebody breathing down their neck telling them whether or not they're billing enough, because if they don't, the clinic doesn't make money and they won't get paid. And it's not that even if a physical therapist did own their own clinic and they took insurance, it's not that we're picking what we're billing and what we're doing with you just because we're interested in making the most money. To be honest, most physical therapists and chiropractors are in so much debt, they're just like, their hands are tied. And this isn't an excuse, because we still like took an oath that we should be providing the best care, but also at the same time, it's just really important to recognize this is probably why some of this happens. And I'm not here to tell you which thing is right or wrong. I do think that everybody deserves better care. It's very complicated and so nuanced in making sure that we can be affordable for people, because we pay so much in our dang insurance, and then you get shitty care and then you have to pay more to come see somebody like Ryan and I, and that bothers me a lot. Like, I wish that wasn't the way it was, but the bottom line is that these are things that probably contribute to some of the issues that we see. So a chiropractor is going to be more likely to adjust you just because they're going to get paid better or paid more, or you're going to get reimbursed for that, versus if they spend time rehabbing you, they're not going to get reimbursed. So that's part of it. The other part is that they're going to educate you in a way that's not necessarily ideal about what they're doing. And there is a lot to be said on how you're educated about something. If you're told that this is going to fix you and this is the answer to your pain, there's something called the nocebo effect, which basically you can kind of convince yourself that something is going to work if you believe. So if you believe something's going to work, that's actually like the number one thing that actually can make sure that it does work, is if you believe it. And unfortunately, if a chiro is telling you this is going to work, it might work, but it might work temporarily. It might not work in the long term, but it helped you at first. And so they're going to tell you it worked because of all these things, which are very outdated, but they may have learned it in their school. It might just be easier for them because their hands are so tied and they don't have money to go learn more because it was an asinine. Or they just don't
have the time with you to
or they don't have the time
explain it,
to
so
educate.
they come up with something quick and simple.
So these aren't excuses, but I'm just saying I don't think a lot of clinicians do things maliciously to try to out you and like trick you into their treatment. But it's really important to just understand there's reasons why all of this happens. And the same with physical therapists. I don't think any physical therapist is trying to create this generic rehab that's like crappy. Like I really don't think so. I just think there's a lot of things wrong with all of the professions like so far down the line, and that becomes like a systemic issue. And a lot of it has to do with insurance. A lot of it has to do with a lot of other things. And so hopefully this podcast kind of gives you a little bit of understanding of all of that, which is why I wanted to record it. So what I want to ask Ryan here to contribute is, what are some things to look at when you are considering whether or not to go to a physical therapist or a chiro?
Let's just break that down first and say, what are some things to consider if you're going to a chiropractor? How about that? So if you're going to a chiropractor because you think that chiropractor is what you need and you're searching for one.
Or you're currently in one.
Or you're currently, seeing one. I would just first do your research from like a website standpoint and see what their website's about. If it talks about only adjustments and talks about subluxation that we talked about earlier, some of the outdated stuff that's not research or evidence based, that to me is like a yellow flag. Like I would start looking at other providers, see if they're more likely to be less hands off or be more empowering and not require you to come into the office for them to quote unquote fix you. And then it's hard for me to say, like, should you go to a PT or to a chiropractor? Like, knowing what I know about most chiropractors, I would say 9 times out of 10, I would just prefer you to go to a physical therapist. But unfortunately, like, there are a lot of good physical therapists that sound really, really good on their website. And then you go into their clinic and like Jen said, their hands are tied because it's an insurance-based clinic. So you have to find and do your own research, like, what vibes well with you? And what are you looking for? Are you looking for somebody to just put their hands on you and make you like feel really good and help you with your pain right then? Like, then find that person. Or are you looking for somebody that's very empowering, that's going to provide you with the education, the tools, the coaching, and the knowledge you need from a movement and mobility standpoint to like help you prioritize this stuff for the long term? Like,
sometimes that just takes time. It's just like finding a
it's trial and error. Exactly. That's a really good one. Like, you go to a hairstylist and it might not be the best haircut ever. You don't just say like, haircuts aren't for me. Like, you go and find a better hairstylist. And unfortunately, a lot of finding a good provider is trial and error. Like,
and it's frustrating because you would hope that, I think we have these expectations for healthcare providers to be like all perfect, and they need to all be at this standard, and they all need to have all these things. But I just don't think that's fair to healthcare providers. But I also think we need to consider, you might be paying for healthcare insurance. I know how expensive it is. A lot of the time, the best providers are going to be outside of insurance for the reasons we mentioned here. And I know that you're like, well, I pay so much for insurance. I have benefits for physical therapy. Most of the time you can have a super bill printed, which is basically the codes, and you can file for any out-of-network benefits to get at least partial, if not all, but most of the time it's partial reimbursement. I would not expect that. Just think of it as a bonus if it happens. But when you go to a physical therapist or a chiropractor who's more movement-based, it's kind of like an investment in your body and your health and your future. And I know that's like super cliche. I totally get it. I know. But what's the alternative? And I know we're spending a lot of money in health insurance, but that's kind of a lot of the money we're putting in health insurance is like a backup. Like
disaster care.
I hate the way that healthcare is in the US. Like it's just, there's a lot of issues. I'm not going to open that can of worms, but it is what it is right now, and we're not trying to solve all the world's problems. I'm just trying to help you deal with the way that it is.
You
and
should just think of health.
Health
insurance is there if shit hits the fan. Like, you're not going to be 6 figures in debt. Like, it's there to help you.
That's the goal, is to not be in medical debt if something happens. And unfortunately,
you have homeowners insurance. You still have to put work into your house and maintain your house. You have car insurance. You have to maintain your car. Like, car insurance isn't going to cover every single thing.
And a lot of rehab for these nagging issues, like, you're taking care of it early on. It's literally just like you getting a gym membership to take care of your health before all of the stuff that you would need health insurance for. That's kind of what it is. And there's arguments on whether or not we should feel like physical therapy should be covered. I'm not going to go under all of that. That's a whole nother thing because I can understand both, and we're not going to go down that route. But a couple things that I do want to highlight with chiropractors versus physical therapists. Ryan and I have talked about this a lot, but a common theme with chiropractors is they will put you on what they call treatment plans. And it'll be something like, I want to see you 3 times a week for 4 weeks, 2 times a week for 6 weeks, and then I'm going to see you once a week for the rest of your life. And that's kind of a joke that we say because they will literally put you on these treatment plans forever. But like, you shouldn't ever really need to see a clinician 3 times a week unless you're post-surgical and there's some manual therapy that they need to be doing. Like there's very specific techniques that or things that can contribute to that. But I would say majority of the time, you don't need to be seeing somebody 3 times a week. On average, if I could see somebody 3 times a week, trust me, they would get better way faster. And if you have the money to pay for that, and you want to pay for that, and you want to get better faster, and you want to put the effort in, like, there's fewer things that will benefit you. Yeah, there's fewer things that will benefit you for an ROI perspective. I really do think that. But nobody is coming to see me 3 times a week. Nobody can afford that. Even 2 times a week, I don't have very many people. I don't have anybody coming to see me twice a week. I've had like one person do that for a little bit. Most of my people are weekly or monthly, and they start out weekly. We get them coached. The coaching sessions are really important, so we'll get a few of those up front. The majority of my people are once a month after that. So we kind of wean them down. So if you were seeing a chiro that's like, I got to see you 3 times a week because I got to put this back in place all the time, those are red flags. You need to get out and find another provider.
And if you do go to a chiro and that first visit, I would say if you're not given exercises and you're only given like an adjustment and some manual therapy and no at-home care, like that to me is kind of a red flag because the adjustment and manual therapy is going to help you in the time being. But like, again, you need to be empowered and you need to be putting in the work to take care of your body.
And then long run, if you zoom out for a minute and get a perspective shift here, one time seeing a person for 1 hour, I think there's like 160 hours in a week or something. I'm going to get the numbers wrong because again, math, right? We're going to give me some grace with math here, but there's a lot of hours in a week. You're going to go see a chiro maybe 3 times a week for like 5 minutes each, or maybe you go to a PT 1 time a week, but like what you do outside of those are going to be matter way more because that's like 98% of your week. And so that matters. And then the other thing to keep in mind is that the manual therapy they're doing, the effects can last like 20 minutes, maybe up to a couple hours, but that's it. And so it's like what you're doing to reinforce what they're doing. Like what you do is going to reinforce what they're doing on you or to you or with you in the office. But what you do matters most because you're going to be doing it more. And that's what's really important. So those are just a few things to keep in mind. I think we covered a lot of things and we talked about some of the problems with like how we explain things. So if you hear somebody explaining the adjustment and subluxation, like what Ryan said, it's definitely good to kind of pull back and be like, I don't know if this is the right person for me. You should also be able to ask questions. That's really important. You should be able to have the time to do that. And I would say it's not whether or not you need to see a chiro versus a PT. It's that you need to find somebody that, one, you feel comfortable and safe with, that makes you feel like you can ask questions and share information, because that's paramount to making sure you have a good relationship. You have to have trust in your provider. And number 2, they need to be giving you a lot of education and empowerment and what to do at home, like Ryan said.
Yep.
And number 3, you need to be told like kind of what the process is. We have no idea exactly how it's going to go, but usually we can give you an idea on, this is how I start with people. This is what you can expect. Here's the process. They should be able to modify and adjust things as they're going. They shouldn't ignore your requests. You should be able to kind of communicate, and they should be coaching you. Your exercises shouldn't be, here's your list of these 3 low back pain exercises. It should be, here's your list, and here is how we're going to go through them to make sure you are set up correctly. Here's how to modify it. Here's what you should feel. Like there should be a lot of feedback given for all of that. So those are things to keep in mind as you're going through. And last but not least, if you go to a physical therapist, I really think it's important to ask them how long, in a chiro, ask them how long their assessments are, ask them how long their follow-ups are. A chiro, you'll be able to weed them out real quick because they'll be like, oh, it's a 3-minute adjustment. That's when you can say, okay, no thanks, goodbye. Unless that's what you're looking for. Of course, if you have all of the knowledge and movement and stuff, and you just want to work with somebody to do a little bit of manual, by all means, and you have all the money in the world, by the way, by all means, more power to you. I would rather spend my money on some more like workout equipment, but I have more knowledge. And I just like, you probably don't necessarily need that, but if you feel like you do, I'm not one to tell you you don't. Yep. You know that better, right? That's part of the triangle. So you can do that. I lost my train of thought there.
You're talking about finding a physical therapist.
Oh, right. And so ask them the time that they're going to see you. And a physical therapist should be seeing you for like 30 to 60-minute follow-ups. And then you need to ask a follow-up question. Okay, well, how many patients are you going to be seeing when you see me? This is a very big question to ask, because if personally, I know no other healthcare provider that you go see and there is another patient right next to you. It's complete bullshit. I get so pissed about it that you can hear it in my voice. I'm pissed because it's absolutely asinine. How are you going to feel comfortable to share any of your information with your physical therapist with another person you don't know right next to you? It's ridiculous. And there are certain cases having two people at a time might work, but it will never be better than a one-on-one. You cannot change my mind about that. And if you ask your therapist or the provider you're going to, just make sure you ask them how many other patients are going to be there while I'm there? Do I have the privacy to talk with you on a one-on-one basis? I work with my clients and we always start in my office, but our office is inside of a bigger gym. There are times when I take my people out into the gym, we're around other people, so I'm not going to pretend that it's like this super private thing, right? But like I always ask if they're comfortable with it, but two, we always start in the office because you have to feel comfortable with sharing things. And as we've been working, we get very close with
build
people's
really solid
lives.
relationships.
And there are things that people would not want to share and have other people hear because there are just very private things that happen. And if you're having, like one of the big things I had somebody share with me, and they felt luckily, I feel like comfortable enough and safe enough that they could pull me aside. But I had two other patients at the time, but they said, "Hey, Jen, can I talk to you for a minute? I need to talk to you." And so we got a room real quick. I had somebody kind of keep an eye on my other patients, and she was sharing with me that she had some numbness in her like genital area, which is like a very red flag. I actually had to call our physician to go in and get an emergency MRI right then. But imagine if she didn't feel safe enough to do that. So it's really important that you feel safe enough with your provider to share those things, because that's important. Even just like something simple of, oh, well, my hip hurts and it's really important for you to fix your hip pain. When we talk to people, we'll ask them, well, what things is it limiting your ability to do? If you don't feel safe enough to tell your therapist that it hurts with sex, and that's like the most important thing with you, well, how is it going to get better? How are they going to know that? And so those are just small, like those are very actually like extreme kind of examples, but they're very common. The second one's super common at least. And so this is why it's really important to ask, like, am I going to be with 2 or 3 other people, or am I going to be one-on-one with you? And I think in healthcare, it should be standard to be one-on-one. I think it's like, think about even personal training. Like, we do group training sometimes, but at a reduced rate. Like, I just can't believe that a clinic is getting paid the same for a one-on-one as it will for 2 or 3 people at a time. And you are not just like a number, you are a person, you're a whole person, you deserve that. So make sure you ask those things and be aware of those things. And I think that's like the most. Is there anything you would add to that?
No, I think you said that, you covered that really, really well. I couldn't have said it better. It does, going back to what I said, always surprise me when I do answer our business phone and people are just randomly calling the closest clinic. And it's like, you could just easily have read a lot of stuff and got a really good idea of what the clinic is like on their website. So don't just call random places.
Ali agrees.
Yep. Just take 10 extra seconds and scroll through their website to see what they're about, because that could be a big difference, whether you find a good therapist or you have to like go spend money on that session to be like, nah, I didn't like that.
And whether you vibe with it. A lot of people have read our website and been like, I think this is exactly what I need. And I think there's a lot of merit to that.
Hey, bud.
And I will tell you, we put a lot of time and effort into our website so that people can resonate. Sorry, everybody is getting home from school right now, and Ali wants to play with all of them through the window, apparently. So those are going to be the most important things, though, to pay attention to. And I think what Ryan said is really important. The website thing is going to be just a simple way to weed them out. We typically don't answer our phone if we are working with patients and clients, which is a lot of the time during the day. So we don't always do that, but we always respond and call back or email, and you can always call or email. I think we text people, so I don't know what other clinics do, but you should be able to do that. And we even offer a 20-minute like consult virtually through the phone. We used to do them in the office. Sometimes we will in the office too, but it's way easier via phone now. So you should be able to do that with the clinic as well. So just shop around, kind of see who you like, and also know that like you might pay money, go into the assessment and learn a little bit about your body, but also learn that you're not vibing with this person. And it's really important to just kind of know that it might take a few sessions for you to feel better. it's not going to be right away. Like when we first prescribe exercises, sometimes it flares you up, and exercises are not like this perfect thing we can figure out. Kind of like medication, sometimes you have to figure out the right one. The right dosage is really important for exercise. The dosage is like the key for us. So just keep in mind that your goal is to make sure you feel empowered, you feel like hopeful, you feel like you are getting educated, you feel like they're coaching you, and that you feel like you can trust this person and build a relationship with them. If those things are checked off the box, then be patient as you're going through things and make sure you're asking questions, and you should feel like you can vibe with them pretty well. And I think that should help you discern who you should work with as a provider in general. And building a relationship with a clinician is super helpful because we all have injuries pop up. It's a normal part. So putting the time and energy into it, just like you would for somebody who's going to do your hair. I know people who've gone to their hairstylist for literally decades. So it's just a lot of time up front, and then usually you don't have to figure it out after that. And then if your hairstylist retires or quits or something like that, then it's another, process, but it's just the same in rehab. So is there anything else you want people to know about chiropractic work, your work, anything like that?
I think that we've covered a lot of good things.
Yeah.
So I sure hope that you've learned something. Just know that not every physical therapist is the same. Not every chiropractor is the same. And just never give up if you're struggling to find that person.
Yeah, I think you said that very well.
Yep.
This is our longest episode so far, but I kind of knew it would be because I already talk a lot, so we're just adding a second voice. But if you did learn anything from this podcast, we would love to hear about it. Share it with somebody who you think might benefit from it. And as always, leave us a review if you could. It's super helpful for people to be able to see those and check them out. That's actually how we built our business through Google reviews. So please take the time to do that. We appreciate you so much. We have a lot of great guests coming up after this, so stay tuned for that. And we'll talk then, I guess.
Yeah, thanks for having me.